Well, the distribution priority areas might be okay in the member for Lawler's electorate. Her electorate is just 17 kilometres north of Melbourne's central business district, but it's not there that the doctors are most needed. It's out in regional and particularly remote Australia, where they are now suffering because of the distribution changes brought about by this Albanese Labor government. And the Rural Doctors Association said the ink wasn't dry on the changes to the policy then doctors were already leaving the bush. Doctors were already leaving those areas in the country which were already doing it tough, doing it hard. I'm proud of the fact that I've put in place, as Deputy Prime Minister, the Murray-Darling Medical School Network. And that goes through Wagga Wagga, Orange, Mildura, Dubbo, so many places that were crying out for doctors, and not necessarily those regional hubs, but many of the little towns around them, many of the little bush hospitals that relied so heavily on those major country centres. And but for that rural medical school network, I don't know where they'd be. I don't know where some of those centres would get their doctors. And I heard the member for Lawler talking about the pharmaceutical dispensing changes. My goodness, country pharmacists, and there are more than 300, they are the only health professional in some of those 300 communities because they don't have a doctor. They don't have a hospital. They just have a chemist that was going to be forced to potentially shut because of that change, because of that new 60-day rule that Labor put into place. And then we look at health and we talk about bulk billing. And bulk billing rates have fallen dramatically, 11% under Labor's watch. Now, if Labor can stand here, if Labor members can get up and claim that we are better served health-wise under them than under the previous coalition government, well, I tell you what, they are absolutely kidding themselves, and they are indeed misleading the House. Now, I am very pleased to talk about the record of the former coalition government in health. Over 94 million telehealth consultations through Medicare to 16 million patients. Now, telehealth is just not the answer. We need professionals, face-to-face. But I tell you what, in rural centres where sometimes you just can't get that face-to-face contact, then telehealth is doing the job. 857 new medicines listed on the pharmaceutical benefit scheme since 2019, just since 2019, in that last term of government alone. More than 128,000 Australians supported by Headspace each year. And I know everybody across the parliament would agree that Headspace is doing a great job with mental health with our young people. 1,400 additional nurse placements for the regions, and it's for the regions. Now, the distribution priority areas changes have enabled places such as outer suburban areas of metropolitan cities, the Gold Coast, Newcastle, Wollongong, to say that we are short of doctors at the expense of regional centres that in some places don't have a doctor for hundreds of kilometres. And it shouldn't be that when in pain, catch the plane. It shouldn't be that way. And doctors should be encouraged in every way, shape or form to put their shingle up in a country centre. But Labor's taken that away. They've absolutely taken away the incentive and the encouragement by putting in place a measure by which they say that some of these peri-urban centres are somehow should be in the distribution priority areas. And they are not. They should not be. They should not be in that list because it's coming at the expense of hard-working Australians. Hard-working Australians, I might add, who carried this country during COVID, when every city type wanted to pull their doona up over their head and pretend that life wasn't happening and it'll all blow over. The regional people in many of these remote centres were doing the farming, were growing the food, were growing the fibre, were doing the mining that kept this nation's lights on, that kept this nation fed, that kept the clothes on people's backs, and not just for Australians but for many other nations besides. And then they come in here with these motions, talking themselves up as though they are the ants' pants to health provisions in this country. Well, I'm calling it out. I'm calling it out. And indeed, Labor has not been good for health, particularly for regional health. Regional health, which is crying out for more doctors, crying out for more nurses. And what have we got? We've got a government that doesn't know, doesn't understand, and worst of all, doesn't care.